go-to resource for U.S. immigration insights. We provide clear immigration news and information. Our platform provides a network of licensed attorneys who can answer your questions and guide you through the process. From visas to green cards, asylums to citizenships, immigrationquestion.com helps you to network with immigration attorneys so that you can move forward with confidence. Sign up today or download the app. Free registration, limited time offer. Stay tuned. We go live in 30 seconds.
Hello everyone and welcome to today's live webinar brought to you by immigrationquestion.com, a networking platform and meeting ground where immigrants, families, healthcare professionals and licensed immigration attorneys come together to learn, exchange information and stay current on US immigration developments. My name is GB Satusa and I'll be your host for today's session. Physician and healthcare immigration in 2026, J-1 waivers, H-1B, NIW and green card pathways. Healthcare professionals and physicians play a vital role in the US, yet navigating immigration options in 2026 can be especially challenging, from securing waivers after J-1 training to choosing the right employment visa. Understanding each pathway is essential for long-term success and compliance. Today's discussion is designed for international medical graduates, physicians, hospital administrators, and legal advocates. We'll cover practical strategies for J-1 waivers, H-1B petitions, national interest waivers or NIW, and green card pathways. To guide us through this important topic, we are joined by attorney Robby Rubin, Esquire. He is a Memphis-based immigration attorney practicing with Siskind Sasa PC, specializing in employment-based immigration for physicians, scientists, and global professionals. Attorney Rubin has experience with J-1 waivers, H-1B visas, O-1 petitions, EB-1, NIW, and labor certification green cards, and previously served in the Department of Justice Honors Program. Attorney Rubin, thank you so much for joining us today.
My pleasure. Thank you for having me. Happy to be here.
Now, before we begin, a quick note for everyone tuning in. ImmigrationQuestion.com is a public platform created for education and discussion. Attorneys who participate do so independently, and the platform does not provide individualized guidance. Everyone joining us live from Facebook, YouTube, LinkedIn, and other platforms, welcome. If you haven't subscribed yet, now is a great time. Grab your notepads and let's get started. Let's begin with the landscape of physician and healthcare immigration. Attorney Rubin, physicians and healthcare professionals face unique immigration challenges. Now, from your perspective, what are the most common hurdles doctors encounter in 2026, and how are these different from prior years?
That's a very good and very pertinent question for nowadays. The first thing that really comes to mind is a lot of the things that the recent kind of executive orders and proclamations that have come out of the White House, going in chronological order, starting with the $100,000 fee for, H-1Bs, which, thankfully we've found that it hasn't had as terrible as an impact as we originally feared, because a lot of our doctors are able to change status within the United States from J-1 to H-1B, or they're doing their residency in H-1B, and they're just getting a change of employer, and in those situations the $100,000 fee won't apply. Unfortunately, we've encountered situations where some issues come up and there's no way to change or extend status in the United States, and the individual has to go out and cancel the process for a new H-1B visa, in which case the $100,000 fee applies. So we haven't, been hammered by it as bad as we thought, but it is definitely something to be conscious of, really more so for, physicians as they're going through the residency and fellowship process, how it's become even more important now than ever that they focus on maintaining their status, so that way they're eligible to change or extend their status to H-1B instead of having to leave the country and go get a new H-1B visa. And then another the other thing that we've been seeing a lot from the administration are these travel bans and benefits pauses from USCIS. So the travel ban really, there's two travel bans. There's the more recent one that placed a ban on immigrant visa processing to a list of 75 countries. That one doesn't really impact us for purposes of this discussion so much, because the majority of our doctors are, number one, already in the US, number two, not trying to process an immigrant visa abroad anyways. But the other one, there's a list of 39 countries that are subject to a travel ban, and those 39 countries are also subject to a pause in benefits from USCIS. So if you're from one of those 39 countries, you're not eligible to do anything with USCIS. You can't file for an H-1B, you can't extend an H-1B, you can't change status from J to H, you can't do anything. So that is a pause. That is not something that is supposed to be an indefinite ban or prohibition. We're hoping that pause is lifted. But as of now, that individuals from those 39 countries are completely entirely ineligible to continue extending their status, applying to change status, or getting a new status even abroad. And then the last thing that's been pretty recent that we've seen stateside, most recently, actually saw, I think the state of Texas this past week just announced that all state agencies and universities are going to stop, sponsoring H-1Bs for their employees. And I think the state of Florida did something similar a couple months ago as well. I don't know if either of those have gone into effect yet. And those could be potentially pretty impactful for physicians that are wanting to work in either of those two states, because if a lot of these universities that are that our doctors work with or are affiliated with, or some hospitals are affiliated with the state that could be impacted by these freezes on H-1B hires, that could be a pretty big deal too. So those are just a sampling of some of the things in 2026 that we're dealing with that have presented some unique challenges.
Now, J-1 waivers remain a major pathway for international physicians. Can you explain the current landscape for J-1 waiver options, including Conrad 30 programs and other alternatives, and what physicians should pay attention to this year?
Yeah, so on the other hand, from all those kinds of new things that have been announced this year that have made life more difficult, we're staying pretty consistent with the waiver programs that we've had in years past. If anything, in the past year or two, it's expanded, and I'll get into those programs in a minute. But it's thankfully for physicians, these programs have largely gone untouched by this administration. I think most probably, because the administration recognizes the healthcare professional shortage in this country and the need to continue employing these, immigrant, non-immigrant doctors to keep our healthcare system functioning. So the J-1 waiver programs boil down to essentially a few different routes. So every state has a Conrad 30 program, which allows them to select 30 individuals who are finishing residency or fellowship that are subject to 212E. So just to back up a little bit and just in case people don't have much information on it, people that come here on a J-1 for their residency training or fellowship training are automatically subject to something called 212E, which is a regulation that says they have to go home to their home country for 2 years after they've completed their residency or fellowship. In order to get that requirement waived, that they have to go home, there's all of these waiver programs in the United States that allow them to stay instead of going home. So Conrad 30 is one of those waiver programs. Each state has 30 slots and each state does it a little bit differently, but generally speaking, each state can fill up to 30 slots of physicians coming out of residency or fellowship to work in a healthcare professional shortage area, a medically underserved area. And that is a determination made by, I believe, it's called HRSA, which is under the Department of Health and Human Services. They make the determination if that geographic area where your hospital is or where your clinic is, if that area is in what they've designated as a healthcare professional shortage area, then that area qualifies and they can hire you using one of their, that hospital can use the Conrad 30 program if they want to hire you. Then in addition to those state programs, there's a plethora of federal programs. The most commonly used federal program, and so these are called IGAs, which is called an interested government agency. So interested federal government agencies have access to, Conrad 30 only gets 30 waivers. The government agencies get as many as they want. The most commonly used one is HHS. They can sponsor waivers, in any state in the country. Again, it has to be in a healthcare professional shortage area, which we call a HPSA for short. And so those are the most commonly used one. Then in addition to HHS, there's 4 regional based commissions that sponsor J-1 waivers for doctors. And that is the Delta Regional Authority, the SCRC, which is the Southeast Crescent Regional Commission, the ARC, the Appalachian Regional Commission, and the NBRC, which is the Northern Border Regional Commission. That, for the most part, covers the eastern half of the United States. Kind of like think about it from like Illinois down to like Louisiana and east, are covered by those programs. And it's the same idea as the Conrad 30. It has to be in a medically underserved area or a HPSA, and they can, those programs cover multiple states. Each program covers multiple states, and they can sponsor a waiver for you. And in all of these programs, the way it works is you transition from J-1. The programs recommends your waiver to the Department of State. The Department of State sends the approval over to USCIS. USCIS grants the waiver, which then allows you to change status to H-1B, where you will perform your 3 years of waiver service, under the terms of any of those programs I just listed. And then at the conclusion of those 3 years, you're no longer subject to 212E, and you're free to change status to whatever you would like, or to adjust to a permanent resident through a green card pathway if that's available to you. The one other alternative for individuals that, for whatever, if they want to work in an area that isn't medically underserved or isn't in a HPSA, one other option for those types of doctors is they can leave the country after they finish their J-1. And if they're eligible, they would have to meet the criteria for it. And so it's a little difficult usually for residents or fellows because they're not so far into their career. But if they are eligible for an O-1 visa, they can go out of the United States, process an O-1 visa. And there's no $100,000 fee for an O-1 yet. But they can go out, get an O-1 visa, come back in on the O-1, and they can work for any employer. But they're still subject to 212E. So all they can do at that point is be an O-1 and extend the O-1. But there's no pathway forwards towards a green card if you do that.
Right. Now, H-1B status is often a bridge for healthcare workers. How does the H-1B process apply specifically to physicians and healthcare employers? And what timing or compliance issues tend to cause problems?
So, as I was just discussing previously, so that's the H-1B is the status in which you serve out your waiver service, your 3 years, or if you're doing a NIW, which we'll get into later, 5 years of waiver service. So as I kind of discussed a little bit earlier, the main thing that in terms of timing that employers and physicians should be cognizant of is that, especially now with the $100,000 H-1B fee, it is imperative that the physician maintains their status, whether it's in J-1 or in H-1B, that they are maintaining that status properly all the way throughout, until they can change status into, from their residency and fellowship to their attending position. Oftentimes, so, the timing consideration is that it takes, from the time you call your lawyer and initiate the J-1 waiver process until the time your H-1B is approved and you can start working is usually at best case scenario 6 months, sometimes 7 months. And oftentimes we'll see in the medical field start dates. Hospitals want these graduates, people that are finishing residency and fellowship, they'll want them to start July, August, September. So if that's the case, then it's imperative that these processes begin at the latest January, February, so that way we don't end up with a delayed start date. Not just the concern isn't just a delayed start date. If your J-1 status, typically it'll end in July. But what you can do, and then what ends up happening sometimes is if you start the waiver process in February, right, and it comes July, and July passes, and now your J-1 is expired, and you go to file your H-1B, well, now you can't file your H-1B because you're not in status. You have to leave the country and go get a visa, which is going to cost you $100,000. So there are strategies that we have to avoid that situation from happening. Namely, physicians on a J-1 are eligible for a board exam extension, which allows them to extend their stay to the end of the month. Their board. If your DS-19 ends in July, then you have a board exam in October. They'll extend your DS-2019 all the way through the end of it, which will give you plenty of time to be, maintaining your status while the whole waiver process and H-1B process are unfolding. So that's just something that we always, caution on, and we usually advise all of our physicians to go ahead and make sure they get their board exam extension. Allow them. So that's really that's about it for that.
All right. So the National Interest Waiver has gained attention among medical professionals. What factors make a physician or healthcare worker a strong NIW candidate, and how does USCIS evaluate these cases?
NIW have, since this new administration has taken over, approval rate dramatically. It's like in tile all the way down to now. Hey, sorry. Did you lose me there for a second?
We lost you for a second.
Okay. All right, I'm back.
All right.
I'm back. So as I was saying, so the NIW approval rates have plummeted all the way down to about the mid 80s percentile to right around 50-50. Some of that is due in large part to the fact that there's just been such a high increase in volume of applications, and there's probably a lot of people applying that shouldn't be, and that's bringing down the approval rates. But part of it is that they are just applying a much higher stringent standard now to NIWs. So with that said, the NIW, it's different than an O1 or an EB1 in that it's not really, you don't have to establish that you have all these citations and research and all of that, and that you have a leading role or a high salary. There's really 3 prongs, and I wrote them out because it's easy to just read them off. So the 3 prongs are that you have to establish that the proposed endeavor has both substantial merit and national importance. So, let's say you're, one example of it, I was working on a case for a dermatologist that was working in, skin cancer research. And, they were able to, show that it's in the country's interest and it's nationally important that they are able to stay here and continue their research because skin cancer is such a prevalent form of cancer, and that's an example of substantial merit and national importance. And the emphasis is also on national. The importance can't be localized to like a community or a city or even a state. They really want to see that there's a national interest. The other prong is that you have to show that the applicant is well positioned to advance the proposed endeavor. That usually is pretty easy. That part's not so hard because, if you are a researcher in something, then you're presumably going to continue being a researcher in that. What we typically would like to show is that the job that they're wanting to stay for is a job that will place them into a position where they can continue doing the research that is of national interest or substantial merit. And then the last criteria is that on balance, you have to show that it would be beneficial to the United States to waive the job offer and labor certification requirements. So that's the reason why national interest waivers are so attractive, is because you don't have to go through the whole labor certification and job offer process. They can be self-petitioned. You don't need an employer to sponsor it. And, because the whole perm and labor certification process is a big headache. It's very expensive. It's an extremely long time. So part of the application is proving to the government that, this is such an important job that, there's no real need to even go through the labor certification process. So it's really just industry dependent. That's kind of what it comes down to. A hospitalist is not going to have such a great argument for a national interest waiver. Just kind of a first year cardiologist probably won't either, unless there's some research that they've done, or they work in a very specific field within cardiology that is becoming more and more important. There's also, the government has a list of things that are like basically pre-approved fields that are of national interest and substantial merit. A lot of those are STEM fields. And a lot of those are research fields in medicine. So we always, and that list gets updated every year. So if your field is on that list, then that helps obviously a lot. So yeah, that's the, and then, the advantage of the NIW, and we'll talk about the PNIW in a minute, is that you don't have to go through the perm process, which is beneficial because it allows you to get an I-140 filed 2 years earlier than you would if you had to wait for a perm to get certified, which is very helpful because it allows you to get in the line for a green card 2 years earlier than you otherwise would have. And there's also other benefits of having an approved I-140. You can get, extensions of your H-1B past 6 years, and you can get, if you're married, you can get your spouse work authorization on an H-4. So that's one of the reasons why the NIW is really the most attractive option. But as the approval rates are coming down, we're seeing it become less desirable.
Interesting. Now, for physicians thinking long-term, green card planning is critical. How should healthcare professionals approach permanent residence strategy early in their careers to avoid gaps or status complications later on?
Well, yeah, so the green card options for a physician coming out of residency or fellowship, presumably we're talking about somebody who's coming off of a J-1. But it doesn't actually really matter that much if they're coming off a J-1 or if they did their residency or fellowship in H-1B. The grades are going to be pretty much the same. So the first option is, and the most common option I would say, is a perm-based EB-2. So if you're just, you're a hospitalist, you're a internist, you're, a primary care, family medicine, then your most likely pathway towards a green card is to file a perm-based EB-2, which requires your company to start the labor certification process, which basically takes about 2 years, more or less. And once that, and that's a whole process where you show that you've done recruitment and that you've interviewed U.S. citizen and lawful permanent resident candidates for the job, and that nobody's available to work the location hours and for the pay that you're offering. And it's just it takes the government over a year to process it. And also the process itself is very lengthy. The interview process, the recruitment process, it's all expensive and takes a long time. But it's very straightforward and very predictable, and there's really no reason it shouldn't be approved. So once the perm is certified and approved, and after that point, which takes about 2 years, you can then file your I-140, which gets you in, which is actually with the perm, what gets you in line with the perm is the filing of your perm. So if you start, a new job August 1st, 2026, and they file your perm for you, let's say December 1st, 2026, your priority date will be when the perm was filed. So if you're not from a country like India or China or the Philippines or Mexico, then you could be looking at being able to file an I-485 after you get your I-140 approved, within the next 3 years or so, 4 years or so. So that's kind of the most tried and true, most predictable process, although it is probably the slowest of all of the processes. Then there is the national interest waiver, like we just discussed above. And then for physicians, then there's a special national interest waiver for physicians called the physician national interest waiver. And it is completely different than a national interest waiver. What it is it is a requirement that the physician sign a contract to work in a medically underserved area for 5 years. Or it's either can be a medically underserved area or in a Veterans Association's hospital. And you have to work there for 5 years. You are allowed to file your I-140 immediately, in those situations. Even if you're subject to 212E, you're still allowed to file the I-140 immediately, which again, as we discussed, is beneficial because it allows for, indefinite H-1B extensions and also spousal work authorization through the H-40AD. Once you have finished your 5 years, you can technically, you can file your I-485 adjustment of status application even if your 5 years hasn't finished yet. But it's not necessarily recommended to do that because sometimes USCIS will take it all the way through to the end and they'll approve you for lawful permanent residency even though you haven't completed your 5 years of PNIW service yet, and that can cause very big problems and you really don't want that to happen. So typically we just wait until closer to the 5 years is up to file the I-485. Once you've completed your 5 years of waiver service, then you are eligible to file your I-485 to adjust to a green card. And all of these, the PNIW, the perm-based, and the NIW, these are all in the EB2 category. So those are the 3 EB2 pathways to getting onto a green card. The fastest way to getting to a green card is the NIW, but also it has the lowest approval rates, and it's also probably going to be the most expensive option as well. Then the PNIW and the perm are kind of your more surefire options. People sometimes will choose the PNIW process because it allows them to file that I-140 immediately, whereas the perm, they have to wait for 2 years to file that I-140. So that's oftentimes why we'll see doctors choose the PNIW pathway. And then, of course, also, like we mentioned above, earlier about the O1s, in certain situations, it is possible that a doctor coming out of residency or fellowship could be eligible for an EB1. And so that's a discussion that would have to just be had with a lawyer to just, vet out and screen those doctors' credentials to determine if they are eligible for an EB1. If they are, then that is by far the fastest way to get to a green card. If you're not from China, Mexico, or the Philippines, or India, then you could be getting a green card in, 2 to 3 months. So, but that's usually not applicable to somebody coming out of residency. But it could become applicable as a doctor progresses through their, 3 years of waiver service or 5 years of waiver service. So that's something we'll have sometimes doctors file both. They'll start off on a perm EB2 and then, they'll be 3-4 years into it and they'll be like, hey, I'm from India. I'm not going to be getting my green card this way for another 25, 30 years. I've accumulated all these credentials and awards and prizes and publications. I think I'm eligible for an EB1. So that's something we'll see. You can have both the EB2 and the EB1 going at the same time.
Now, given workforce shortages and evolving immigration policy, what practical planning advice would you offer physicians and healthcare employers who are navigating immigration options in 2026? Like I was mentioning earlier, it's a bit of a long, as far as immigration is concerned, it's not that long, but it is somewhat of a long process, the waiver process. And it's very, for a physician, it's very important that they are doing everything they can to make sure they're maintaining their status throughout the entire, their entire time in J-1 or H-1B, whatever it is. So
with that in mind, knowing that it's going to take about, if you have an August 1st start date, you should be thinking about, you want to give yourself 7 months if you can. Sometimes it's not possible. Hospitals don't necessarily move that fast. But if you can, you really want to give yourself as much time as possible to get your waiver filed and the process started. If you're wanting an August start date, you want to be on top of if a physician, you want to make sure you have your USMLEs completed. You want to make sure you've looked into how to apply for a state license in the state that you've accepted a job offer in, because that can be very important. And you want to just stay on top of your employer and make sure that they're initiating the waiver process for you as early as possible, because from a timing standpoint, and if you're trying to plan ahead, if you don't get it started till March, you're not going to be starting your job as an H-1B doctor until October, which is going to leave you in a situation where you could be 2 to 3 months without pay, which can be very difficult. And then, for an employer, it's kind of the similar advice. It's important to be active in the recruitment process early of physicians, because if you get in touch with a candidate who you're interested in, who will need immigration support, you want to be able to get them in touch with a lawyer as soon as possible for the same reasons, because the employers don't want to be in a position where they're without a doctor that they were counting on for 2 to 3 months to start the year. So it's just important, especially with everything with the changing landscapes and all these travel bans and benefits pauses. You really want to get things done as quickly as possible and as early as possible.
Thank you for those valuable insights, Attorney Rubin. For everyone watching, immigration planning for healthcare professionals requires careful preparation, documentation, and clear understanding of how J-1 waivers, H-1B, NIW, and green card options work together. Now, staying informed can make a meaningful difference in long-term career and immigration outcomes. If this is your first time tuning in, welcome. ImmigrationQuestion.com is a networking platform where users can ask immigration-related questions at no cost and engage directly with participating attorneys. We're also proud to share that ImmigrationQuestion.com is BBB accredited and ISO certified, reflecting our commitment to transparency, accountability, community education, and security. Now, Attorney Rubin, based on your experience, how do platforms like ImmigrationQuestion.com help immigrants and immigration attorneys like yourself?
Well, it's hard for me to answer that. I'm kind of new to immigration questions myself, but having a resource like this that allows employers and people that are seeking immigration help, a resource that's free of charge could be very beneficial to at least help educate. I think ultimately, especially in these times, you really want to ultimately be engaging with an immigration lawyer. But with that said, and I think this also applies to patients in a hospital in the medical field, you want to be an educated consumer. You want to go into it kind of having making sure that the lawyer you're working with knows what they're talking about. You want to be able to educate yourself before you really dive deep into something with a lawyer, to make sure that they're considering all the possibilities, and that they seem well prepared to discuss your needs.
Now, before we move into our live Q&A, one final question. Attorney Rubin, for healthcare employers or international physicians who feel pressure to file quickly or pursue a single pathway without exploring alternatives, what warning signs should prompt them to pause and reassess their strategy before moving forward?
Well, I mean, if an employer is feeling pressured by an employee to file quickly, then they just have to kind of, first of all, I mean, I would assume that the employer has engaged an immigration lawyer or has some form of in-house immigration counsel. So first step is always no matter what, always consult with your immigration lawyer. If you have an employee that is being a little, I guess, too aggressive and pushing for a quick filing without having all the documents ready together, and then it might be a good idea to question whether that type of an employee is a good fit for that employer. That's not the type of behavior. I wouldn't want a doctor to be rushing anything. I wouldn't want a doctor to be rushing preparation for a surgery. I wouldn't want an immigration lawyer to be rushing preparation for an immigration petition. So it is important for immigration lawyers and for employers hiring people on visas to move with purpose and efficiency. But it's also, I would say, equally, if not more important, that things are done, with thoroughly and thoughtfully, and because ultimately it's kind of like speeding in a car. Like, yeah, if you drive 50 miles per hour and at 35, you think you might get there faster, but you also might get pulled over by the police and delay your eventual arrival even longer. So same thing applies here. If we rush something out, then yeah, great, we rushed it out. But if it ends up having holes in it, then we're going to set ourselves back even more time to, end up having to respond to an RFE or a notice of intent to deny, and just, prevent all sorts of hazards that could come along the way.
If you've just joined us, we've been speaking with attorney Robby Rubin, Esquire, on physician and healthcare immigration in 2026, J-1 waivers, H-1B, NIW, and green card pathways. We are now moving into our live Q&A session. This is your opportunity to ask questions directly to a licensed immigration attorney. Please drop your questions in the chat or call us live at 516-703-3483 and we'll take as many as possible. I heard J-1 visa interviews were paused in 2025. Has it resumed this year?
Yes. So they were paused earlier in 2025. It was the F, M, and J. The student base, that was kind of all wrapped in together with all the student visa stuff that happened earlier in the year. But J-1 interviews have resumed. That was kind of the whole social media vetting issue where they were trying to set up better protocols to vet candidates for those F, M, and J visas to make sure that they, whatever kind of things that they were looking for, in terms of national security that they could be looking for from a doctor, I don't know, but that was what that pause was all about. But we've seen a resumption in J-1 visa interviews at consulates.
Right. If I finish residency but my waiver processing takes years, can I still work?
I'm not sure I really understand that question. So, your waiver process, there's no reason that a waiver process should take years. If you finished you wouldn't even really start a waiver process before you finish residency. So the way it works is you'd finish your residency, or I guess you would be in the last year of your residency. I'm sorry. So you'd be, in this third year of your residency or the fourth year, however long your residency is, and you would start the waiver process. Like I said, you'd want to start it no later than really February if you anticipate a summer or early fall start date. But my so you could. It's a little hard because I don't fully understand the question. But to say, can I still work? I would say you can only start working if you're going from J-1 to H-1B. You can only start working once your H-1B is approved. Period. It doesn't matter how long anything's taking. You are not eligible to begin working for any employer until your H-1B is approved.
All right. How long will it take to get a green card as a doctor under EB2 NIW?
So it depends where you're from. So if you're from a country like India that is, or China, or that's backlogged in EB2, over a decade, then you're gonna, your pathway towards a green card is just, dozens of years. But if you are from, any other country besides India, China, Mexico, or the Philippines, then the visa, it all goes by the visa bulletin. So I could check right now what the priority date is on EB2, but I think it's about maybe in 2023, maybe even in 2024 is what they're doing right now. I'll look it up real quickly here, so I can just give you a good sense. So the website that I'm looking at now, it's the Department of State it's called their visa bulletin, and you compare your priority date with your, in the case of an NIW, would be the date that you filed, the date that USCIS received your I-140. If that date is before the final action date for EB2, so right now it's April 1st, 2024. Or for right now, I think it's actually dates of file. So it's either October 15th, 2024, but we'll call it April 1, 2024. So if you filed a NIW now and got it approved, you know, and you're from the, you know, a non-backlogged country, you know, it's January 2026 right now. So you'd still probably be looking at multiple years until you're getting your green card. You know, the visa bulletin, it's hard to predict. Sometimes EB2 will jump 3 months. Sometimes it'll jump no months. Sometimes it even moves backwards. So if it moves backwards, that's obviously very bad news for everybody. But assuming, you know, it kind of progresses like 4 to 6 weeks every month, you know, you can use that to try to figure out, you know, when you'd be eligible for a green card. But you know, right now, if an approved NIW right now, you'd be looking at probably, I would budget for 3 years, 2 to 3 years.
Right. Now, recent reporting shows that a federal judge has halted the Trump administration's plan to end temporary protected status for migrants. Attorney Rubin, how should physicians and healthcare professionals interpret developments like this? And what does it reveal about the importance of staying current on immigration policy changes?
So, I mean, I don't really do a ton of work with TPS. You know, my area of expertise is really in physicians and employment, and I do a lot also with religious workers. So it's hard for me to really comment. I wouldn't really want to opine too much on something that I don't practice a lot. But I guess what, you know, it kind of just is an example of how quickly things can change in immigration. You know, the administration can kind of just announce, you know, a change, and then that's that. And you know, you have to deal with it. There's, you know, with these travel bans too, and the benefits pause, there was no warning. They just announce it, it's effective immediately, and you have to deal with it. So, you know, there's not really too much that you can sometimes do about it. You know, if you're an employer, you want to just always be in a position where you can act as quickly as possible and be as organized, you know, be, you know, in a position where you're organized and ready to make a filing quickly if you need to. But, you know, sometimes there's just not much you can really do when the administration makes such sudden changes.
Thank you so much, Attorney Robby Rubin, for sharing your time and expertise today. Your explanations of healthcare immigration options helps clarify a complex system for physicians and employers alike. For everyone joining us today, thank you so much for joining today's webinar. And we hope this discussion helps you better understand J-1 waivers, H-1B, NIW, and green card pathways, and why careful planning is essential for long-term success. You can always visit immigrationquestion.com to ask immigration-related questions and stay informed about upcoming discussions. If you would like to revisit today's session or share it with others, the full replay will be available on Spotify soon. Just search Borderless Talk by immigrationquestion.com. Join us on Friday for another live conversation covering key immigration updates and practical guidelines. Until then, stay informed and stay connected.